an 18-point lead for Indiana. They're shooting 71%, right down the middle. Franz Wagner.
What a stride around Durant. Beautiful move by Franz Wagner.
On the way with a little shove. Step back three by Wagner. He drills it.
Franz doing a nice job working those feet. Good balance there.
Caldwell Pope, and then just gather and go up strong.
Wagner with 3 sixers around him.
On December 6, 2024, Orlando Magic won against Philadelphia 76ers. During this game, Franz Wagner had torn his right oblique. Today we will be analyzing his injuries and what went down. This analysis will cover the injury's mechanisms, signs and symptoms, diagnosis, treatment, rehabilitation, and prevention strategies. Before we get into the injury, let's do a quick overview. Obliques are the muscles along the side of your belly. They are part of your core and play a significant role in athletic movement. Franz Wagner specifically ruptured his external oblique, one of the outer sheaths. Franz Wagner sustained a grade 2 external oblique muscle strain of the right side. The injury occurred on a high-impact drive to the basket, on which Wagner took contact attempting a layup. Upon impact, his torso had abrupt axial rotation and lateral flexion, a mechanism known to overload the oblique musculatory. The external oblique muscle is part of the anterolateral abdominal wall and is a significant contributor to trunk rotation, lateral flexion, and core stability. The external oblique muscle, the internal oblique, and transverse abdominis work together to support dynamic movement as well as spinal protection during sport. Within this particular play, the combination of rotational torque and deceleration forces, plus possible compression due to defender contact, most likely led to micro-tearing of the muscle fibers, which then progressed to a partial muscle rupture. This type of non-contact muscle injury is commonly referred to as a musculotenosis strain and is a category of soft tissue trauma. Players of this type of injury often complain of a sudden onset of lower lateral abdominal quadrant pain, trunk rotation or deep limitation of function, or lateral abdominal wall tenderness to palpation. In the video, Wagner is seen stiffening the side after the play, with subsequent reduced physical activity and less forceful movement, which is classical behavior that indicates of acute abdominal wall trauma. The Orlando Magic's medical personnel diagnosed Wagner with a torn right oblique muscle, as established using magnetic resonance imaging, also known as an MRI, which provides detailed pictures of soft tissue structures. MRI is the preferred standard for the diagnosis of muscle injury, allowing assessment of the location and severity of the tear. The team released a statement that Wagner was unavailable for an indefinite amount of time, requiring another 4-week assessment to track his recovery, with a call for conservative comeback. To effectively assess Franz Wagner's injury, we use the HOPS approach, a medical tool used in sports medicine that stands for history, observation, palpation, and special tests. Franz Wagner's injury history includes a torn right oblique in December 2024. However, before this incident, he has also had a history of multiple ankle injuries, including a sprained ankle in January 2024. He also has missed time with a wrist fracture in 2019. On observation, trainers noticed visible discomfort and limited movement in his trunk, especially during rotation and lateral flexion. He avoided certain positions, which is a guarding behavior common in muscle strains. For palpation, during Wagner's physical exam, he had tenderness and localized pain in the right lateral abdominal wall. This region aligns with the external oblique muscle. Finally, special tests were done. Pain was found on resisted trunk rotation and side bending, as would be expected in grade 2 strain of the external oblique. Once Wagner was evaluated, medical teams acted quickly to address the injury and make sure no further damage occurred. He was removed from play right away to stop further irritating the tear. Cryotherapy, a type of ice therapy, was likely used to address inflammation and pain. He was likely given anti-inflammation drugs to address swelling. A compression wrap may have been used to stabilize his trunk and limit trunk movement. During this acute phase, rest was essential, more precisely, refraining from any twisting, torso bending, or core engagement. Wagner's recovery was directed by a return to play protocol for an oblique strain that was standardized and evidence-based. The first 7 to 10 days of therapy focused on rest and light recovery. He performed isometric core exercises like bracing without moving and light stretching to maintain tissue mobility. This stage minimized aggravation while maintaining rudimentary neuromuscular function. At 2 weeks, Wagner began introducing low-impact cardio like stationary cycling and walking for cardiovascular conditioning. Core exercises were introduced without rotation, and light resistance training was introduced to sustain foundational strength. At 4 weeks, his rehab advanced to sport-specific phase. He began progressive resistance training that engaged the obliques, planks and side bridges, for instance, and initiated light basketball drills like stationary shooting and footwork drills. In weeks 6 to 8, he advanced to controlled rotational drills, agility drills, and defense movement. He was now in reconditioning phase, which prepared his body for the demands of competitive play. Medical staff monitored him for any sign of pain, restricted motion, or instability. After sitting out for 20 games, Franz Wagner finally returned to play on January 23, 2025, approximately 7 weeks after the injury, demonstrating that his core strength, endurance, and range of motion had returned to baseline and passed all return-to-play criteria. To wrap it all up, Franz Wagner's torn right external oblique was a hard break, but it's also a great case study in sports medicine. This type of injury really demonstrates just how vital the oblique muscles are, not just in basketball but in all high-level athletic movements. These muscles contribute to core stabilization, rotation, lateral flexion, and force transmission through the trunk. So an injury just like this can seriously cripple performance and mobility. What this injury taught us is the importance of core stability for injury prevention. When the core is fatigued, overused, or not properly conditioned, the risk of strain, especially in high torque activities like basketball, it increases. Oblique strains are especially tricky because they can feel minor at first, but if not managed correctly, they can become chronic. Franz's rehabilitation also reminded us about the value of a stepwise progression of rehabilitation. From rest and limited activity to isometric exercises to core and sport-specific training, and finally to clearance testing before return to play. There is no shortcut for the healing of soft tissue. Full recovery entails restoration of range of motion, endurance, and strength, especially in the dynamic movements that athletes rely on. To avoid such injuries from happening in the future, athletes can benefit from incorporating a core strengthening program, doing a proper warm-up before games or practices, and maintaining their physical load within the season. Such steps can avoid overuse and keep players like Franz Wagner at their best, pain-free.